Well, welcome everyone to our Primetime Alive program, Demystifying the Spine. I'm Vicki Newell and I manage the Primetime Alive program here at Mary Greeley. I just want to remind everybody, if you'd like to join Primetime Alive or sign up for other programs that we offer, you can visit us at mgmc.org/PTA. Our presenter today is Dr. Jonathon Geisinger, and I am going to let him do the rest of his introduction because he has some great slides giving his education history and that. So please welcome Dr. Geisinger.
Thank you, Vicki. As she mentioned, I'm Dr. Jonathon Geisinger, and I'm relatively new to the area. Been here for the last 5 months and doing spine surgery here with McFarland Clinic in Mary Greeley. So with that, the topic that we're going to talk a little bit about today is kind of the mystery that surrounds the spine. The spine is really, it's a confusing, complex thing for a lot of people. And really, if you take a step back and kind of look at it in a kind of a stepwise fashion, then it's really something that's not too hard to figure out. But before we get into that stuff, I just wanted to give you a little background of myself and where I'm from. And I'm originally from Spencer, Iowa area, and actually just south of there, Peterson, Lynn Grove, Sioux Rapids. And you know, this slide, it shows the Clay County Fair, and I think that's something that everybody can kind of relate to with Spencer as being one of the more famous things that town's known for. And just an absolutely great event we do every year up there. And then that's me and our combine right there, and that's my middle child, Atlas. And that was just last weekend. We were up on the farm combining, and my folks still farm up there. And I try to get up and do as much as I can whenever I can with that. So anyways, from there, in my training, I went down to the University of Iowa, and I spent 4 years in undergrad and another 4 years of med school there. From there, I went to a hospital called Beaumont out in Royal Oak, Michigan, which is in the northern suburbs area of Detroit. And it's a huge level 1 hospital with just a lot of orthopedic surgeons and a lot of volume and really excellent training. And just a really great facility that they had out there for 5 years of residency. It's actually so big that they even have their own animal research department, and they have a whole building designated for animal research. And I got to take part in some sheep surgeries out there where we worked on stem cells and fusion rates and things like that. So this is actually an ACDF procedure that I do for humans, but on a research model, we were using sheep to look at stem cells. And so I think that's pretty cool that I got that opportunity in residency to operate on animals. From there, I went to Twin City Spine, and that's the group of guys I graduated with. Large spine center with 5 fellows, which is pretty large. Usually, most places have 1 or 2 fellows, so it's a really robust program they have up in the Twin Cities. And this image just kind of shows the complexity of the things that we dealt with there, which was a lot of complex cases and a lot of good people that we took care of up there. From there, I was in Sioux Falls for 3 years practicing spine surgery in private practice, and there's a picture of my family there, and then also the place I was at, Orthopedic Institute. But I got a call, and there was a spot opened up in McFarland Clinic, and I was really happy to come down. I have several good friends that work with the clinic here and with the hospital, and I just know what a special place it is, and I was very happy to have the opportunity to come down and be the spine surgeon for McFarland Clinic in the area here. So that's my background, but let's get into some of the things that kind of cause back pain and kind of help demystify and pull back the curtain from some of the things that are going on in people's backs when they have pain. So really the back, just like every other part of your body, can be broken down into the same simple things. Like your ankle has muscles and ligaments around it, so does your back. Same things. Unique to the back, though, are things like discs, and discs can cause problems for people. They can pinch nerves and cause stenosis. Sometimes spines become unstable and can cause instability, which leads to pain. Sometimes deformity or even the bone itself can cause pain. And we're going to dive into each one of those as a special topic here. So first off, muscle strain, right? Everybody strained a muscle in your leg or your calf or your thigh, and you know that pain that it brings on. And your back is no different. And it's got more muscle in your back than almost anywhere else in your body, really, especially considering the different layers. And it's got more muscle in your back than almost anywhere else in your body, really, especially considering the different layers. And it's got more muscle in your back than almost anywhere else in your body, really, especially considering the different layers. And it's got more muscle in your back than almost anywhere else in your body, really, especially considering the different layers. And with this slide, I'm really trying to show all the different layers of muscle that your back has, right? And so I also want you to notice really from the top of your head being up at the very top aspect of this photo down to the very bottom aspect, which would be your tailbone, you can see the muscles are connected the whole way. And so it's not just one area when you have a muscle strain. It really can radiate up and down your back and even up into your neck when you have types of muscle strain. And just to add on to it, another layer of muscle. And yet another layer. And you can see they each get bigger and they get longer and they just continue to interconnect and give our spine stability, but can also be a source of pain. And a lot of times this pain's coming from people who are working in different positions or different postures. And obviously we all have cell phones now and we're staring at our phones and computers more than ever. And that leads to a lot of muscle fatigue and things like that that can really, really build up and cause muscle strain and pain for people. You know, always weekend warriors going out doing new activities you haven't done for a while can lead to strained muscles and things like that too. A big one that I think that people don't pay enough attention to is stress. And we all know that when your body's stressed, you just feel more on edge, right? More tense. And that's a physiologic thing. We have glucocorticosteroids or steroids that are released into your body, and they kind of amp up that stress response. And dealing with stress isn't something you can just turn on and off the switch for. So if you have a stressful day, I know we all go home and maybe you watch TV or do something and you feel like you've decompressed for a half an hour, but it takes your muscles longer than that. You've built up that stress over the course of the day, weeks, or months, and it takes a good amount of time for your muscles to relax and for you to come back down to a calm state. So, you know, I think we do minimize stress in our lifestyles and think it's a on-off kind of thing, but it really isn't. It's something that builds up, and you have to be conscious of it to allow that stress to dissipate and allow your muscles to kind of get back to that relaxed state. And sometimes you need help doing that, and we'll get into that too. Another thing, ligaments, right? So you can imagine if you sprained your ankle badly. Everybody sprained their ankle probably at some point, and sometimes you get a really bad sprain, and it can last months before that feels better. Well, again, your spine is no different. We have a lot of ligaments around our spine. Each one of these segments is basically connected and held together by ligaments. And this next image kind of shows a little bit more detail. All of those white things connecting the bones together, the fibrous kind of looking things, those are all ligaments. And each unit, like I said, is held together by a ligament. So oftentimes people, they do something, they twist, something happens, or maybe they don't even know what they did. And it can lead to these very painful episodes of back pain, neck pain. And it's oftentimes people talk about it being the worst pain that they've ever had in their life. And what happens is just like you sprained your ankle, you can sprain your back, and that can lead to a lot of pain. So how do we treat these things? Really, muscle and ligament strain, that can be treated kind of all in the same encompassing plan. A lot of times rest is your best friend initially, but then you want to get back to activity and stay loose. You don't want to get too stiff. Anti-inflammatories, ice is very beneficial. Sometimes people find heat beneficial, and they just can rotate between the best, and that's what I hear works for a lot of people. Massage is just absolutely great for helping relieve stress. Acupuncture works for some. Chiropractic can be good. Physical therapy really is beneficial. And then just understanding and understanding what position you put your body in, being mindful of the stress that you're under, and trying to find some relaxation techniques to help treat some of those things. So, moving into another category that causes pain in people's backs and necks, there's disc pain. And there's really two different types of disc pain. There's disc pain from just degenerative discs called discogenic pain, and that can be anywhere in your neck, your back, and typically that does not cause radiating pain. That just causes pain that stays in your back or your neck. And that's just part of the normal aging process of discs throughout your spine. The other type of pain is a disc herniation. And a disc herniation is when you have the actual disc herniates out and touches a nerve. And in this illustration here, I've removed one of the vertebral segments. And you can see that white disc is what's left there. And in the middle of that, we kind of talk about it like a jelly donut. And sometimes that can herniate out. And when that herniates out from the center and touches your nerve, it can be incredibly inflammatory and painful. And so that's another cause of back pain. And the next thing is, how do we treat these things? And so they can also be treated in a similar fashion. You can rest, use ice, anti-inflammatories, massage, acupuncture, chiropractic, physical therapy. And really, surgery is not a good option for people who have isolated disc degeneration or discogenic type pain, right? And there's a lot of reasons for that, but just in general, surgery typically isn't done for just degenerative conditions where the discs are starting to wear out. The other type of disc pain that we talked about was a disc herniation. And these, fortunately, 90% of them just get better with time. And that's because just giving some rest, ice, and anti-inflammatories leads to that disc kind of getting smaller and retracting and taking the pressure off the nerve. And when you can take these anti-inflammatory medications, it kind of acts like water on a fire, and it really starts to put out some of that painful inflammation that people have. Sometimes people continue to have pain, and the next step is doing an epidural steroid injection for disc herniations. And I have found that a lot of people get really good relief with a timely and well-placed epidural steroid injection. And that's really like putting a fire hose right on that fire and getting the nerve and the disc and things to calm down. And people generally get some very good relief from things like that. So then if all of these things aren't working and you're having pain that's usually goes past 6 weeks, or if you're getting some progressive weakness or numbness, that's when I talk to you about the services that I can do, which would be going in and just taking down that part of disc that's touching your nerve. And this is an example of a disc herniation that I did for a person. And you can see as you come down, that big mushroom thing kind of in the middle is a disc herniation. And just by going in and taking that out, you can give a lot of relief to the nerve and to the pain that people are having that go down their legs. And I apologize, I was trying to bring up a pointer so I could point right at it. So the next thing is stenosis, or pinched nerves. This is a very, very common problem for people. And what stenosis is thought of as a pinching of the nerves right in the middle of the spinal column. And people who have this condition are typically, they're walking where they're hunched over. A lot of times I ask them and say, hey, when you get up and you start to walk somewhere, are you looking for the next place to sit down? And people who really have stenosis say, yeah, I'm always scanning, always looking for the next bench or the next place to sit down. And a lot of times the symptoms include back pain, but pain that goes into the buttock and thighs when they're standing and walking. And then sitting down takes that pressure off the nerves and gives people some relief of those symptoms. And this MRI has two images side by side, and you can see the white in the very center on the right. That's fluid around your nerves, and nerves love to have fluid around them. And the image on the left is from the same person, but just at the level where they're stenotic at, so a few levels down, where you can see it's all black in the center, and the nerves are being pinched, and they don't have that fluid around them that gives them the nice cushioning. So treatments for spinal stenosis, again, anti-inflammatories, sometimes oral steroids, physical therapy can be beneficial. Epidural steroid injections really help a lot for this too. Usually people will say they've had a shot or two and they become less effective with time, but really those first few shots give people a lot of relief from these types of symptoms, and sometimes that can last days, weeks, months, and even sometimes years for people. And if all of these things aren't helping, surgery is another option. And surgery is something I do where I go in and I clean off the bone and I free up the arthritis and the discs and things that are pinching those nerves centrally. And these can be really rewarding surgeries where people do get a lot of relief from their buttock and thigh pain. Another thing that causes pain is instability of the spine, slip discs. So this is an image here in the x-ray show at the very bottom where the bones are actually slipped forward and they're moving. And when that happens, as you can imagine, it really pinches nerves and can lead to a lot of back pain and pain going into the buttock and thighs. More kind of the sciatica type pain where it shoots down your leg, kind of like an electric bolt sensation. Lots of different ways to get it, 7 different ways to get it. Most people are either born with it or it's traumatic. And actually the vast majority is degenerative, where the joints just become arthritic over time and they start to slip and move and then pinch the nerves. So treatments for spine instability, again, is going to be your anti-inflammatories. You kind of see a common theme of trying to bring down the inflammation, right? Another thing would be epidural steroid injections, and they can also bring down the inflammation, which gives people symptomatic relief of their symptoms. Physical therapy, strengthening your core, right? So all those muscles that I showed you in the beginning that attach to your spine, you can work to strengthen those with therapy. And if you do that, you provide just enough strength to those bones that they slip just a little bit less and give your nerves some relief. But at the end of the day, if all these things aren't working and you find that you're having more bad days than good days and you're having back pain and pain going into your legs, this is when we talk about the spinal fusions. And, you know, done under the right circumstances, these really help people and give them a lot of relief from their back and leg symptoms. And it's a way to give stability to the spine that's causing pain. The next topic's deformity. Obviously, scoliosis, things like that can be very painful for people. And there's typically 2 types we think of. Adolescent, that happens when you're younger, and then degenerative, that kind of happens as you get a little older in the years and your back kind of wears out in a condition that causes it to take on a certain curve. And a lot of times people notice this deformity when it gets severe. They'll see maybe they're hunched over, or maybe some people talk about oddly enough, people say, I feel like my belly button has moved to the side. And then you look at their x-ray and see a curve, and that kind of makes sense, right? People also can get pinched nerves with this, where it gives them pain into their buttock and thighs, or where it radiates down the leg. So this image is more of a degenerative type scoliosis, where you can see on that left image the curve that goes off to the left, and then on the side image there on the right side, kind of the hunched over type view. So treatments for scoliosis, for younger people, bracing is very effective, and then if that fails, you can go on to get surgery. These are x-rays of a child who went on to get surgery for their scoliosis. And really, one of the most rewarding things we do in spine surgery, I think, is that correction for young people with scoliosis. And you'll think back to before we did this, and you would have more people in society with deformities, and maybe even people that didn't even live into their 30s or 40s because of their deformity from their scoliosis as an adolescent would cause heart problems and lung problems. And really, it's an amazing thing what we've done with orthopedics to identify and correct those deformities in reliable ways that have now given people who quite possibly could pass away in their 20s and 30s to having a full and wonderful life. And then the other type of scoliosis with degenerative, again, anti-inflammatories, physical therapy, and then sometimes more selective surgeries, but sometimes bigger surgeries. So bone pain, another source of pain for people. This can happen from fractures, trauma. Some people get osteoporosis, and which leads to compression fractures, and that can be painful for people. And also stress fractures that you can get with repetitive activity. And that's an example there of a compression fracture at L1. And then the last type of bone pain is an unfortunate one, but sometimes malignancies can find their ways to the bone and can cause pain for some people. So I think some of the key takeaways from this is that there's a lot of things can cause pain, but 90% of those things will get better with some conservative treatment and time, okay? So a good question to ask is when should you see your doctor, right? So I would say if you have a sudden onset or persistent weakness, meaning your leg's not working, your arm's not working, maybe it's getting worse, whether it was a sudden onset or it's just persisting, that's a good thing to go and talk to your doctor about. Same thing for numbness. If it's a sudden onset numbness that seems to be persisting and not improving, probably a good idea to go bring that up to your doctor, all right? If you have severe pain, another good reason to talk to your doctor, whether it's back or neck or pain that's shooting into your arm or your leg. In fact, if you do have pain that's shooting into your arm or your leg and it feels like it's coming from your neck or your back, there's a good chance it is, and it's a good chance it's a back or a neck issue that's causing that pain to shoot into your extremity. I would also say if your pain is lasting for weeks to months, it's probably something you should at least look into. And I say that because most things are very simple, and there's a lot of simple treatments you can do to help you live a more active and functional lifestyle. And then also, if you're having pain that goes into your legs, kind of that claudication, what we call it, neurogenic claudication, which is pain that goes into your buttock and thighs when you're up and walking and gets better when you sit down. It's probably spinal stenosis that you have, and there's a lot of really great treatment options for that. So seeing your doctor, treatments that they can offer you, anti-inflammatories, maybe they would do a short course of steroids, physical therapy, activity modification. And I think that's an important one because I think if you think about any business, we kind of get into the thought process of you're not thinking outside the trenches of things, right? So let's say you're at work and you're continuing to look at your computer in a certain way. It's something you don't even notice that you're doing anymore. So going and seeking help through a consultation with your physical therapist or even your chiropractor and saying, hey, how am I positioning my body? What could I be doing different to kind of change that position can oftentimes lead to some real significant relief in your life. And then also giving it some time, doing these things and giving it time to have that treatment plan take effect. Different testing you can look at, x-rays, MRIs. Typically, x-rays would be one of the first line things to evaluate for neck or back pain. And if things aren't improving, usually the next step would be looking into an MRI to get a more advanced image of what was going on. So we have a couple of great specialists here in our pain center, Dr. Thuku and Dr. Peranto, and they do treatments like injections, epidural injections, trigger point injections, which are injections kind of into the area that's most painful for people, medial branch blocks, but really just a whole host of different therapeutic things that they're able to offer people, whether it's injections or medications and physical medicine, and there's really a lot that they can do and a lot that they do to help people. So when those things are not seeming to give you relief of your symptoms, when you've tried therapy and you've maybe tried some oral medications, anti-inflammatories, maybe you've tried injections, and things aren't getting in better, it's a great time to maybe have a consultation with me and see if I can look at your imaging and look at your, and kind of take a look at your information and see if there's something else that we can do to help you out. Also, if you're having real severe symptoms like acute weakness or persistent weakness or numbness, maybe it is a neurologic thing that would need to be addressed sooner than later. Incoordination in upper and lower extremities, issues with walking, feeling like you're going to kind of have this sense that your head's disconnected from your body can sometimes be indicative of a spinal cord issue, and that's something that I see a lot of people for. And also people that are having a lot of severe pain that shoots into their arms or their legs is often something that I would see in my clinic. And then also fractures and trauma and things like that. So a big part of what I do when people see me is I go through their symptoms. I talk about their neck pain, their back pain, and get an understanding for what are the symptoms like? Is it shooting into the arm? Is it shooting into the leg? What's the exact region it's going into? Because I can take that information and I can process that and try to localize, that key one or two places that's really causing the issue. I look at the different treatments you've tried, therapy, injections, medications, and see what's worked and what hasn't. And then a really, really important thing with the consultation that people have with me is I go over your MRI with you. And I say, you know, you tried this, these are what your symptoms look like, and I try to correlate that to their imaging to see if I can help them. So really important is having that next study, that MRI or a CT or something that we can go over together and hopefully be able to identify something that we can help with. So in summary, I would say a lot of things get better with time, and also doing some conservative treatment, therapy, injections, and oral medications. But if your systems are persisting, a great place to start is your primary care provider, the person who knows you best. Oftentimes they make referrals over to the pain center, or sometimes people are just seen in the pain center, and they have a whole host of things they can try to get you feeling better. And a lot of times if those things aren't working, or if there's something that's real concerning that your doctor's concerned about, then I will see you in my clinic and we can go over your MRI, your imaging, and kind of get a better idea of if I'm able to help or what the situation is. So, yeah, with that.
I don't think there's questions, but do you want to?
Yeah, yep.
Read that one and then answer
Yep,
that one.
we have a question here. Says, what are some things one can do to help prevent or at least delay the onset of some of these degenerative spine problems? Right, great question. And it's a question you get a lot, right? So it depends a lot on what your occupation is. What is your activities like? So I would say people that are in construction and heavy lifting and things like that, throughout the course of time, that can be really tough on not only your back, but your joints and everything. So, so if you do have a real heavy, strenuous job, maybe as time goes on, you get into something where it's a little bit lighter paced and maybe more desk type work. So that can be very important. Another thing is smoking, believe it or not. That can lead to faster, accelerated degeneration of your discs and things of that nature. So not doing that. Staying thin, staying fit, those are very important things. If you can work on that core musculature to not just rely on your ligaments and your bones for stability, but to also have that good foundation of core strength can lead to a better outcome with your life. There's some things you can't do. There's genetics, right? We all have, where we all hear about genetics, and I tell people a lot of times, if people have heart disease in their family, it tends to run in their family, and there's not a lot they can do. They can modify certain things and cholesterol and things, but at the end of the day, sometimes the things that you do are just a genetic component to it, and backs are no different. A lot of times, people I see say their mom, their dad had back problems and things like that. So, there's some things you can do, but there's some things that that you need help from others for too.
Now, since this is a group mainly 60s, 70s, 80s, is there anything when you think of that age group that maybe they need to focus on? Or is it still the same thing?
I think it's pretty similar, staying fit and trying to stay thin. Obviously, that's tough for everybody. And yeah, kind of the same advice I would say for it, yeah.
Did any other questions come up?
I deal with some mild neuropathy in both feet. Can that be related to my degenerative discs? Well, it depends. If it's isolated to the feet, we talk about the distribution of it. And if it's more covers your feet, like a sock going on, it's probably more of those small nerves in your feet. If it's not radiating down your legs or it's not positional, it's probably not related to your back. So obviously everything is connected, but sometimes if people do have neuropathy, whether it's from chemo treatments or diabetes or a number of other reasons, vitamin issues, there are things outside of the back that do cause neuropathy that are not treated in the back.
Any other ones come up then? Nope. Doesn't look like it.
Nope.
All right.
Thanks.
I'll
You're
pop
welcome.
in. And if you have any lessons?
No.
Okay. You're
I'm good. Thanks, everybody.
All right. I'll pop in here then. Well, thank you, Dr. Geisinger. Great program, wonderful slides. Thanks for taking time out of your day to present for us today. And then I want to remind everyone we do have a program next week, again on Tuesday, November 16th at 2 p.m. Dr. Melissa Wells with McFarland Clinic, Rheumatology, is doing a program on the causes and types of arthritis. So thank you for joining us and have a great day.